sponsored by Douthat Insurance.
Well, we are now less than a month away from Medicare's open enrollment period. So now is really the time to start doing your homework, looking at the changes and making sure that you're on the right plan. And it can certainly be overwhelming. There is a lot to consider. Joining us this morning with more are David and Margaret Douthat with Douthat Insurance. It is great to have you guys back on the show. I said you've got to come this early because it won't be long now, and I'm sure very, very busy.
Yes. Thank you for having us. Yeah, and it is crazy. All of a sudden, just like that, yeah. We're in the thick of it. So. Yeah.
And now is like kind of that time before, because we now know sort of what it's going to look like, what the changes are going to be. So now is a great time to really start looking at those plans. What are you guys seeing when it comes to some of those changes?
During this time, if you're already on a plan, you're going to get an annual notice of change sometime in the next week or so, probably. So you'll know by that how your plan is going to change for next year. We'll get that information also about the same time. So it's time to look and see, is the changes major? Is it something, hey, that I want to look at something different? Gives you that option to look for next year.
Are there some big overall changes that you guys are seeing that made you kind of take note?
I think the biggest change that's coming forward are the Medicare Part D changes. So that's really relating to the prescription coverage.
Okay.
And there's been some, a large impact in the overall cost for those that are on Medicare. So currently, if someone has Medicare coverage with prescriptions, they can actually spend up to $8,000 of their own money before everything is covered in full. Next year, that will drop to $2,000. So there's going to be changes not only in their monthly cost for the actual coverage, but their medications could be shifted around into different tier levels, and they could see some changes in just what the prescription cost up front. And there'll be different ways to manage the way that they put that money out. And so, you know, that's the big thing. People really need to be looking at the material that comes out to them by their current company. And if they're coming into Medicare in the very near future, those are things that we'll be able to go over more with them. But that's big for people who have been spending up to $8,000, and now their costs out of pocket could be as low as $2,000.
Yeah, that's a big difference, especially for somebody on a fixed income. And then I also understand there's some big changes with the dual plans.
Yes, dual plans are specifically for people who have Medicare, A and B, and Medicaid. And in the state of Tennessee, that can look like a pink QMB card, or it can look like a TennCare card. So they come in different forms there. But the bottom line is, right now, and for several years, these individuals, if they have both and they're on a Medicare Advantage plan, they have actually been able to change one time every quarter. So if they weren't happy with a plan, or found out a physician wasn't in their network, or their medication wasn't covered, etc., they would be able to make a change once a quarter, where everyone else would not have that just automatic opportunity. Okay. So next year, that's changing, and they will not be able to make a change once a quarter. So that is also something that's going to take a little bit of time to adjust to, and they need to know that.
And of course makes it even more specific, so that they come to someone like you who can go through that so that they are on the right plan, because if not, then of course they're stuck with that plan for several more months. Tell me a little bit about what it's like for you guys when you come up with and work with these clients to kind of make sure that they're on those plans. I know you've built so many relationships over the years with your clients.
We try to work with people from the very beginning all the way through. So coming onto the plan, being able to explain all the different options, because we represent almost every plan that's in this region. So if somebody has a different company or whatever, we represent them. So walking them through them, finding out the best plan for them. Then after they get on the plan, over the years, if they have issues or questions, you know, we're always there to help them. So that's what a local agent will give you. You can always come in and sit down and look at us face to face, or give us a call on the phone.
And of course, you're right there on the main highway there in Kingsport. I drive by all the time right there on South Wilcox Drive. Thank you so much for joining us today. Some great information. Hey, if you would like more, you can find them right there. Is their address right there. You can always check out their website as well, douthatinsurance.com, or stop by and see them or give them a call.
The preceding portion of Daytime Tri-Cities was sponsored by Douthat Insurance.